Hello guys, welcome to my channel A.Medical Knowledge. Welcome to the playlist of surgery. In this topic, we are going to discuss about the joint dislocation, which is very important topic as the point of view, the clinical point of view, as well as the point of view of your syllabus. Let's start our topic, joint dislocation. Dislocation. What do you understand by dislocation? The word dislocation is refer the position of anything which is deviated from its normal. So dislocation is the separation of two bones where they meet at a joint. We all know the normal anatomy that the bone meet at the joint. If they are separated from the position, that's mean the bone is dislocated. Dislocation of bone is no longer in its normal position. As I told you before, dislocation may be cause ligament or nerve injury. So remember, when the joint or when a bone is pulled apart, the nerve or ligament around it, of course, they get hurt, they get damaged, they get not in normal position. So this happen when dislocation occur. It may be periarticular fracture or it may be intra-articular fracture happen, but most of the cases joint like dislocation is periarticular fracture. Then the next topic is subluxation. It is incomplete or partially dislocation. This is the stage after that dislocation occur. You can say subluxation is before stage, like after that dislocation occur. It tells about that the bone is incompletely or partially dislocated or not. For example, nursemaid elbow is subluxation of head of radius in the elbow. In the elbow, the radius is deviated from its normal. That's why we call it a subluxation, and it is partially or incomplete. Traumatic dislocation, as the word suggested, it is due to some trauma, fall a specific joint, or any force that applied on the bone. Joint may cause the bone to displace or dislocate from its normal position. It is a traumatic dislocation. Dislocation causes may be sudden impact on joint, blow or fall on other trauma. Dislocation symptoms depend upon the history, it depends on the pain, it depends on the swelling, it develops on the difficulty in the bone, or maybe patient complain the numbness or paresthesis sensation. Paresthesis is numbness and the tingling sensation is known as the paresthesis sensation. So the most important, when you are getting the history, which is very important, you have to remember the dislocation is partially, subluxation, yeah, incomplete or completely. So history in this topic is very important. In the process of injury, you have to listen carefully the patient, the history, then you go for a subjective diagnosis, mean x-ray or other things. Dislocation signs: if we see visibility out of a place, discolored or misshaped joint. When we see with our naked eyes, if the patient come in emergency, you are not say go and do x-ray. First of all, you have to examine, physical examination, then you see there is a visibly out place of the joint. In next we see the slides in which there is different pictures of showing dislocation. It will show the discolored, the areas showing yellow or bluish due to incomplete circulation. The joint may be misshaped in some cases. There is the joint movement is limited. There is burst or swollen area. The painful intensity is very high. The patient complain that it is very painful, or bearing any weight or move it, the patient complain pain. There is a sensation loss also distal to the joint, and there is the pulse cool extremity distal joint. The most important feature which you have to remember, the distal joint, there is always the loss of sensation in the distal joint. If there is a problem in the forearm, the elbow, the hand, the distal area related to it become cold, there is a loss of sensation, we can guess there is a problem in the proximal part. Okay, so remember the last 2 points, which is very important. If we go for a nomenclatures of dislocation, first of all you have to name the joint, then name the distal fragments, then fracture, which type, open or communicated. First of all you take the history, then you will go that there is a dislocation of that joint, maybe radial, there may be femur, जो भी those dislocation whichever the joint there, then write the distal fragments relationship, then write the fracture, which type of a fracture occur, as we already discussed in our previous videos fracture types. You have to write it and then go for x-ray or see if you have anything, the subjective history, so that you can go for a prognosis. Now look at the spectral radiography. Two plane 90 degree of each other, good quality है, standard view, see the entire joint. Dislocation of elbow, you can see in the right side there is a proper, but after that the bone is moved away from the joint, so dislocation is occur. Treatment: reduce the dislocation as soon as possible, check neurovascular function, take post reduction radiography, immobilize the joint. First and the foremost, if the patient come with the dislocation and it is saying that it is very painful, I can't tolerate it, you have to do, you give IV in the form of anything painkiller, you give first recommendation. After that, immobilize, apply the traction, as we study in the previous videos, apply the traction so that the joint is immobilized for the while. And after that, after 2 to 3 days, if you get OT, give them a time of 40, then relocate the joint, which is relocation of a joint. It is done by orthopedic and it is very time taking procedure. So before that you have to immobilize the joint. Reduction technique: start with IV, as I told you, give sedations, apply traction force, manipulate the joint. General description and management of dislocation of shoulder joint. Now we are specifically studying the shoulder joint. Head of humerus, scapula, there is acromion, there is glenoid, there is a spine, there is a glenohumeral joint, there is a clavicle, collarbone, acromoclavicular joint. These are the shoulder anatomy. Then you can see the subscapularis, the supraspicularis. You have already read it in anatomy, but just I am giving the background of the frontal, teres minus or back view. Head of humerus, this glenohumeral, the joint, the bone is dislocating from the joint, as you can see. The head of humerus is moving away from the joint. The scapula border, as you can see, the glenoskapula, glenohumeral joint. This is normal anatomy. There is a clavicle, there is a acromoclavicular joint. Check neurovascular status, basic movement, internal external rotation. Palpate the acromial clavicular joint, palpate acromion and humeral head. Then check the neurovascular status, finger move, you can say move your finger, light touch finger, so that there is any sensation loss you can refer to neurologist. Neurovascular status, finger move, light touch finger, pulse, cooler, finger move, light touch, or check the neurovascular status. Then check the basic movement, there is internal external rotation or abduction, the movement which are possible on the, as you already studied the shoulder movements, you have to check. Then palpate the acromoclavicular, palpate all over the things. Then dislocation post, mostly interior, 95% dislocation होते हैं. When you see the x-ray, the bone is humeral head is moving to the interior side. When we see the 5% chances of posterior side, and inferior 1% होता है. Habitual non-traumatic dislocation may be multiple direction, ligament laxative, and it is painful. Usually indirect fall on abductor or extensive swallow may be directly blow on the shoulder from the behind. Patient in the pain, hold the injured limb with other hand close to the trunk, the shoulder abducted and the elbow is kept flexed. There is a loss of normal contour of the shoulder. As you can see, the interior dislocation, the joint, acromioclavicular joint is moving away, acromio-humeral head is also moving away. The interiorly dislocate. X-ray of dislocation of shoulder, as you can see, एसोसिएटेड इंजरी होगी न्यूरोवास्कुलर बंडल इन एक्सिला में, मोस्टली एक्सिलर सर्कमफरेंट नर्व एंड एसोसिएटेड फ्रैक्चर आ रहे थे. इन इमरजेंसी यू शुड रिड्यूस in less than 24 hours avascular necrosis head of you. Following reduction, immobilize as I tell you before, 3 to 4 rest with collar or cuff, sedation, applied traction in the form of plaster or anything, left humeral head into glenoid. Hippocrates method, a form of anesthesia or pain ablation, require Stimson techniques, so sedation, analgesics दे रहे होते हैं, पेन किलर. Then Koch's technique is a method used in hospital, general anesthesia, muscle relaxation. As you can see, Simpson technique, and in the previous video we Hippocrates techniques. By with the hand we are giving the pressure. In Simpson's we are giving with the weight. Koch's technique we are giving with the hand. Complication in NV, there is a neurovascular injury, there is axillary nerve injury, fracture of femur or greater or lesser trochanter. Avascular necrosis, hypertrophic or recurrent discoloration. As you can see, the dislocated ball, normal hip joint or void cup component. In the next video, we are going to discuss about the hip joint, which is very interesting and a little bit difficult topic, but if you see this video, it will be easy for you. Thank you for watching this video.